Oklahoma State University's School of Medicine in Tulsa is changing some recruiting and training strategies to ease Oklahoma's acute shortage of rural doctors. ONR's Kathy Tatum takes us to a hospital in Tahlequah and an FFA class in Wagoner County to see what's changing and why.
We could talk about ethics all day long.
Bailey Diffie is a senior at OETA High. Throughout her high school career, she's participated in FFA, Future Farmers of America classes.
This is Ying, my sheep.
For her class project, she's raising a sheep to enter in livestock shows.
I work with him every evening and walk him and teach him to brace, and that's going to pay off in the show rings.
Diffie is among the first FFA students in Oklahoma recruited while still in high school to consider a career as a rural physician.
I've always wanted to be in the medicine, like the medical field, but I never knew what I wanted to do. And then talking to Dr. Schrum helped me out a lot.
Dr. Casey Schrum is the Dean of the College of Osteopathic Medicine and Provost at the Center for Health Sciences at OSU-Tulsa.
We have a pretty big issue with the shortage of primary care physicians in rural and underserved Oklahoma.
To reduce the shortage, OSU is taking an unusual step. It's teaming with FFA to encourage rural high school students to become doctors dedicated to practicing medicine in Oklahoma's smallest communities.
We have to look at doing things differently than what we've done in the past. Medical schools have typically, reached out to college students and encouraged college students.
Reaching out to high school students, especially those participating in FFA, targets a group of potential physicians already familiar with country life. Schrum says 4 things have a really big influence on where doctors practice medicine.
Where they grew up, where they went to college, if their medical school has an emphasis on primary care and rural health or underserved within their curriculum, and then where they do the residency program.
Hello, Miss Rossi, how are you doing?
So, in addition to encouraging FFA students to become doctors, OSU created a special rural health tract for its physicians already in training.
How are you feeling?
I'm feeling a lot better today.
This past year, the Oklahoma legislature passed a bill that will help us develop residency programs in rural Oklahoma.
Durant, Enid, and Tahlequah are established, and we're trying to get Lawton started up for western Oklahoma.
For the first 2 years of medical school, students in the rural physician program live and train in Tulsa at the OSU Health Sciences Center.
But now I'm thinking that it's more likely related to the incision.
For the next 5 years, they train in rural hospitals. Dr. Charity Holder finished medical school training in Durant. Now she's doing her residency in family medicine at Tahlequah City Hospital. She says the program gives participants more hands-on experience than a typical big city training hospital.
I talked to some of my colleagues up at OSU, and they said that on their OB month, they only got to deliver 2 babies, and they technically didn't get to deliver them, they just assisted. Well, my classmates and I that went down to Durant and Amanda Reed in Tahlequah, our comparison charts, we were delivering 30 babies a month. We were catching them. We actually got to do all the procedures. We were first assist, whereas third-year residents didn't get to be an assist. We got to first assist on all these really awesome procedures. We were in surgeries all the time.
When Holder finishes her residency, she plans to practice in her hometown of Colgate. Dr. Schrum says having a physician in a small town doesn't just keep the community physically healthy.
In order to have industry in rural areas of the state, in order for the economies in rural area to flourish, they really need a physician there.
Page 9, where we ended up Friday.
So, Schrum believes when FFA classes sow the seeds of interest in becoming country doctors, it's as much about securing Oklahoma's future rural health care as it is about cultivating our state's rural economic health.